What got you into the medical field? What got you to where you are at right now?
No, I actually want to care for people, and I love the science and the anatomy behind it.
And, today we're definitely going to be focusing more on, the oncology, the cancer portion of your expertise. And so, with everything that's changing right now, I feel like we're seeing a lot more and hearing a lot more about different types of cancers, skin conditions, things like that. So what are some of the common skin conditions that you see your patients going through while they're going through treatment, cancer treatment?
So we see a lot of neuropathies, which is diabetics also get, peripheral neuropathy. So they're feeling like...
And what is neuropathy?
So it's like numbness and tingling to the fingertips, to the feet. And sometimes it can cause excruciating pain.
When you're practicing medical aesthetics, are there certain types of skin cancer that you're seeing? What does skin cancer really look like?
For the most part, skin cancer is managed through dermatology at first. So basal cell is a lot, but we have patients who will, ask what do you think of this? Ideally, if you have something on your skin that is changing shape, changing color, changing texture, or is continuously bleeding. So you might have a little mole or something, and maybe it starts just bleeding a little bit, and then maybe randomly starts bleeding again. Those are all signs that you should get that checked out. Yeah, something abnormal is going on. Melanoma as well is another skin cancer, and it's actually extremely aggressive. I guess I didn't realize it until, I was in the field. It spreads so fast. And so I always urge people, if something doesn't look right, you could be completely wrong, and maybe it's just a wart. At least it's that and not something. Yeah, get it checked out. So
welcome to another exciting episode of Beauty Talk Podcast, proudly sponsored by G Skin and Beauty Institute in partnerships with estheticians.com. Today we have a very special guest, Yvonne Robles, a family nurse practitioner with over 20 years of experience. Yvonne specializes in hematology and oncology at Premier Suburban Medical Group and aesthetics at Unica Beauty Lab. With a wealth of knowledge and all the passion for overall skin health and wellness, she will be sharing invaluable insights into skin conditions related to cancer treatments, aesthetic practices, and preventative health measures. Stay tuned for an enlightening and educational conversation with Yvonne Robles. Thank you, Yvonne. Thank you so much for being here with us today.
Thanks for having me.
So let's really just start off with the background, right? What got you into the medical field? What got you to where you are at right now?
Honestly, I wanted to be a physician first. I really like caring for people. I like talking to my patients. No, I actually want to care for people, and I love the science and the anatomy behind it. So my focus became nursing. And then I started my own business because, I started my aesthetics practice. I love science, and I'm fascinated with the human body, what the human body is capable of doing and repairing itself and healing itself. And at the same time, when you're doing aesthetics, or even just Botox, people think oh, you're just shooting my face certain places, but you have to look at the anatomy of where the muscles are, how the muscles are movement. Is one muscle stronger than the other muscle? How much am I doing that? So it's a little bit of an art. Yeah. So for me, when I do that stuff, it's science and art together. I really love doing lip filler. I don't know why. It's to be able to create something, and that's my kind of art there is the face. So, but I'm still paying attention to like where the arteries are, or where your muscles are, and all that. So,
and all of that.
yeah.
Yeah. Well, that's beautiful. And, today we're definitely going to be focusing more on, the oncology, the
Yes.
cancer portion of your expertise. And so, with everything that's changing right now, I feel like we're seeing a lot more and hearing a lot more about different types of cancers,
Yes.
skin conditions, things like that. So what are some of the common skin conditions that you see your patients going through while they're going through treatment, cancer treatment?
So a lot of patients, I think even when I went into oncology, I thought everybody just got chemo. And a lot of treatments are either like immune therapy or targeted specific therapy. So it's not all chemo, but I would say that some of the common things I'm seeing are a lot of dryness in the skin.
Okay.
And it's not just, my skin's itchy or something. It's like extreme dryness to the point that sometimes fingertips are peeling.
Yeah.
They're dry and cracked. So we see a lot of neuropathies, which is diabetics also get, like peripheral neuropathy. So they're feeling like.
And what is neuropathy?
So it's like numbness and tingling to the fingertips, to the feet. And sometimes it can cause excruciating like pain. I have some patients where it even like radiates like up their legs. We have some treatments, some chemos that even just like touching a cold glass of water or a cold drink kind of is painful for them.
Oh, yeah.
So we have some medications that we can give for that. But I would say most of the time that kind of improves after treatment. Other times it's kind of permanent. So.
Okay. Okay, so then once you have identified these different skin conditions, what are your recommendations for your clients? Like, let's say for like severe dryness, like what are you recommending for them?
So I have a funny story. Maybe it's not a funny story, but I didn't realize that a lot of people don't use lotion daily. And I just grew up using lotion daily. I don't know if that was a cultural thing, but I just thought everybody used lotion every single day. So when I would talk to my patients about like, your dry skin, what are you doing at home already? I like to find out, what are you doing at home to kind of, what's your routine to fix this? And it came up in a discussion with a patient that I was like, well, what kind of lotion are you using? And she was like, oh, I don't really use lotion. And I was like, what do you mean you don't use lotion? I'm like, you don't get out of the shower and like put lotion on your whole body? She's like, no. And I was like, I thought maybe it's just this patient, maybe she just doesn't use lotion. And then I went and asked other people in the office, and a lot of people don't use lotion every day. So it's maybe like 50-50. And it was just mind blowing. So for chemo, you'll get really dry skin, but hydration is like key, a very rich emollient cream that kind of keeps hydration in. Maybe even knowing that you're going to go through some kind of treatment, start hydrating your skin with lotion daily, using a non-scented without any like chemicals or dyes. So I always recommend, I don't like to recommend brands, but anything that doesn't have a fragrance, that is made for sensitive skin, kind of just helps prevent that cracking of it. Once you get to the point, or once they get to the point where they're getting like, cracks in their hands and stuff, sometimes it does require prescription medications, but a lot of patients will put gloves on, trying to prevent infection in the cracks of the skin.
In the cracks of the skin. Okay. So that was actually going to be my next question. Like, are the products that you are recommending, are they over the counter or are they only prescription?
No, I think ideally whenever we try to recommend something, that is available to them in a store. Like, I don't want to just throw a prescription at my patients, whether it's constipation or dry skin, so recommending just go to the store, try this, super sensitive, non-fragranced soap, lotion. And then if that's not working or it's getting worse, then we have to go to like prescription.
So one of the things that I know that you said, and I feel like in my family, and if my family is watching this, and I know you guys can advocate for this, but I'm like the water Nazi. I'm always like, if somebody is like, oh, I have a headache, did you drink enough water?
As they say,
are your muscles,
yeah.
Or I have a pain in my shoulder, have you been drinking water? You have a stomach ache, have you been drinking water?
No, that's how I am with my older kids too. And they make a joke. My husband and my older daughter laugh about it because she'll be like, my head hurts. I'm like, how much water have you drank today? Yeah. But you wouldn't believe how many people between the oncology clinic and even because I do medical weight loss. Yes. Okay. And so in my intake with that, I go through what's your diet like, how much water are you drinking, what's your exercise routine, and so many people don't drink enough water.
And water doesn't include coffee, juice,
and they think tea. It does. It's like it's a liquid. It's I have one patient who I walked in and he just looked just so dehydrated, and I was like, well, how much water have you drank today? And he's like, water? Well, I have what are they called, Arnold Palmer's, where it's like iced tea and like lemonade. He's like, well, I drink those. I was like all day long.
Oh my gosh, so it's actually a diuretic.
It was like all day long, like you have no water. And so yes, I'm a water Nazi as well. I absolutely tell people you need more water. You need more water. Yes.
So when you're talking about, because I have very close friends that are in the medical aesthetics field, and they always talk about how your beauty starts from inside.
Yes.
And even in nutrition and in your skin health, going through oncology and these treatments, what are you recommending nutritionally for them while they're going through these treatments?
I think ideally for oncology patients, nutrition is very individualized based on how advanced their disease is. And also a lot of the treatments or chemos are very, can cause nausea and vomiting and constipation and bowel issues. And if you think about it, there's a lot of like abdominal cancer. So, whether it's colon cancer or stomach cancer, some patients we just try to push nutrition. Like if it's getting a protein shake or, like those supplement shakes, if that's all you can do, that's all you can do. Patients who are more advanced in their disease, like it's just eat whatever you want. You know what I mean? Like just eat something. They're losing weight. Protein is big. I try to, like, if people are very thin, not eating much, try to drink as much water as you can. Try to get as much protein as you can, because the protein you need, so you're not muscle wasting. But it's different than we also, hematology. When people are asking things like, how can I prevent being anemic? Or ideally, I like to promote both in my medical weight loss, and in general, just like a whole foods diet. I'm very big on fruits and vegetables, lean proteins, water, whole grains. I know there's a lot of diets out there that exclude bread or, keto, no fruits. Yes. And I'm a big believer of any diet where you're excluding a food group is not a good diet. It's not maintainable. And there's so much nutrition in just whole foods, like fruits, vegetables, that you're not going to get from a box. So then going completely on the other spectrum, right? Can you tell when people are having bad diets, and what are the foods that contribute to like a bad diet not only just generally speaking, but while they're going through this treatment, what are like absolute no's that you're like, you know what, you really should stay away from these types of foods? I wouldn't say that it's related so much to the treatment, but in general, I think very processed foods. You're ideally have no nutritional value. You know, whether it's for your skin, you need nutrition to make healthy skin, whether it's you're going through cancer treatment, you need as much nutrition to heal and fight it, to be healthy. But you're not going to get that from fake food. You're not going to get that from something full of sugar.
Yeah.
Fried food in general is just very bad for your heart. So I'm like,
if you're trying to promote healing,
yes,
you want to take care of all your body systems.
Yes, you want to just nourish your body as much as you can. Give it the energy, you know, give it the right, like people who have fancy cars, they want to put the best gasoline in their car, right?
Yeah.
So, you know, we should treat our bodies like a really expensive car and just put the best food in there.
That's a great analogy.
Yeah. And
that I'm
like,
sure a lot of people can relate to.
Yes. And I understand there's a lot of, you know, social issues that people can't probably afford. Healthy fruits and vegetables and whatnot. But even as, you know, even as much as you can, you know, even if it's a bag of apples and you eat one apple a day, it's better than putting a cupcake.
For like, even like Latinas, you know, well, at least where I'm from, we always accustomed to have rice, beans, and then a protein.
Yes.
But something that we've been doing that we used to do without thinking is boiling your own beans and not getting them out of a can where it's all the like the preservatives and the salts. And
and what I started doing was, you think about like refried beans, you put manteca or lard in them. Instead of doing that, like add a little bit of agua, you know, the juice, and just break it down that way, so you're not having the additional animal fat that's in there. Saturated fat. So.
And I've even heard that the animal fat is probably even healthier than all of these like modified oils.
Yes.
That we're using.
If you're going on a tier of fats, in my eyes, like the worst fats are probably all the manufactured ones. So margarine, what is that stuff called? Crisco? I don't want to, you know, like, what is that even called?
It's
like a vegetable shortening. That's what it is. Okay.
That's what it is. Yeah.
It's probably not the healthiest. And then, you know, I would say animal fats, you know, and then, you know, of course, healthy fats, avocados, nuts. Your body needs fat. So, I know I'm probably older than you, but a long time ago, there was like the low fat diet. Ideally, yes, you're not supposed to eat a lot of fat, but you need some fat. Your skin needs fat. Yes.
Nuts, avocados. We were talking about this earlier.
Salmon, like omega, you know, has all those fish oils that are really good for you, really good for your cholesterol and stuff. So, salmon is probably, it's a very fatty fish, but it's very good for you too.
So actually, just a little fun fact from, and I don't remember where I heard this, but they were saying that margarine is actually just one chemical away from being plastic.
Oh, that's disgusting.
Yeah. So it originally was developed to make turkeys gain fat, but not even the turkeys would eat it.
Oh, wow.
So then they modified it a tiny bit, and now that's what
is margarine.
As margarine. Yeah.
That's disgusting.
Buyer beware.
Yeah. I just use regular butter. Yeah.
Yeah. It's more delicious anyway, right? Mm-hmm. So as an aesthetic nurse,
excuse me,
what are some of the conditions that you're seeing more and more often coming into your practice?
I think the aesthetics world is completely different than oncology. I see a lot of women. I have yet to see them. You know, I know men get aesthetic treatments, but I have yet to see a male come into my office. But many women are concerned about the process of aging, whether it's, you know, sunspots or skin discoloration, melasma, wrinkles, you know, the sagginess of skin, losing elasticity.
Losing fat.
The fat pads moving, and it causes, you know, a lot of sagginess. And I'm guilty of that too. You know, I look at myself and I'm like, whoa, who are you? You know what I mean?
Yeah.
I don't have like lasers or anything in my clinic, but a lot of those issues can, be handled with a combination of things, like good skincare, whether a lot of discoloration of the skin can be with some skincare, even prescription skincare can help with that, laser treatments. But I primarily probably deal more with, wrinkles.
Okay.
Wrinkles and, the loose skin to an extent. So,
Okay. And so what are your recommendations for, because now it's like, we see all the influencers talking
yes.
about, well, I use Roman, I use Dysport, I use, so what are your recommendations for those?
I use two different, actually, I have three different neuromodulators that I can use.
Okay.
And ideally, they all do the same thing. I think people are just more used to hearing the name Botox because
it's a brand.
It's a brand.
Yeah.
So I compare it to when I'm trying to tell people, like, do you want one versus the other? And everyone's like, I don't know. I thought it was just all Botox, and it's not. I compare it to like Advil and Motrin.
Okay.
They're both ibuprofens. They both kind of do the same thing, but they're just different brand names. And so one company has Dysport, one company, has Botox. I don't recommend one versus the other. Some people have a preference. I tend to think that Dysport probably is a little more effective a little bit sooner. But the length of how something lasts or how long it lasts and effective it is very individualized. Some people don't, one doesn't work as well as the other on some, and it could be complete opposite on the next person.
Yeah.
And also depending on people's metabolism is how fast things can last. So obviously if you're more active, you work out a lot, or just even have a high metabolism, things are not going to last as long.
Yeah. So and I'm sure that a lot of people are wondering about this question. So I know that I personally read that through Botox or Dysport, one of the main differences, is that with Dysport you see like a quicker result, but then it also diffuses.
Yes.
So
the molecules
not just staying in one spot.
Yeah. So the molecules are smaller, so you get a little more spread than with Botox. But I think for the most part, you can use them both interchangeably. And then also many of the treatments that are done are also considered off-label, even because when you're doing them to the lower part of the face, if you think about it, some are only approved for like your forehead, your crow's feet. So I personally use them interchangeably. So
okay, so then if you switch to one, it doesn't matter.
No.
You can go back to the other.
I sometimes will do my own, or I'll have a friend do mine, and since I carry both, I'll use what I just happen to have at the moment. Yeah. I also get Botox for migraines for medical reasons. And it's not in an aesthetic way at all. Where my neurologist places it sometimes leaves my face looking crooked and I have to fix it. But I also feel that because I think she gives me like 150 units, like all over my head and in my
which is not a lot, guys. Which 150 units is not
I probably have 150 in my face too.
Yeah.
But I feel for me that when I do Botox on my face, it probably doesn't work as good because I'm getting it so much in other places. So
in other places, okay. But that's very interesting to know. I'm sure that a lot of people know that you can get Botox therapy for migraines.
Yes.
But also, you heard it here from Yvonne that it's not going to be aesthetic.
Oh, no.
So don't expect that, if you're going to go get treated for your migraines, that miraculously you're going to come out like flat-faced.
No, not at all.
And
it's like when I have my clients, like everybody's muscle's different. The way you frown is different. Mine's wearing off. So the way you frown, the way that your forehead wrinkles are, everything. So, your injector should always examine your face and kind of have you make all those facial movements so they know where they need to place the product.
Oh, yeah.
When I go for my migraines, she does none of that whatsoever. It's just kind of like, I go here, here, here. I mean, it's all over in my hair. So it is absolutely not for aesthetic reasons. Yeah.
Okay. And then, so now that you're in, when you're practicing medical aesthetics, are there certain types of skin cancer that you're seeing? What does skin cancer really look like?
I actually don't see a lot of skin cancer. For the most part, skin cancer is managed through dermatology at first. So basal cell is a lot, but I mean, we have patients who will, ask like, what do you think of this? Ideally, if you have something on your skin that is changing shape, changing color, changing texture, or is continuously bleeding. So you might have like a little mole or something, and maybe it starts just bleeding a little bit, and then maybe randomly starts bleeding again. Those are all signs that you should get that checked out. Yeah, something abnormal is going on. So a lot of the punch biopsies and whatnot, like I said, are usually done in a dermatologist's office. We manage them when they have spread. So if like a squamous cell spreads to another part of the body and they need like chemo or systemic therapy, is when you get sent to oncology.
Okay.
And melanoma as well is another skin cancer, and it's actually extremely aggressive. I guess I didn't realize it until I was in the field. It spreads so fast, and so I always urge people, like, if something doesn't look right, you could be completely wrong, and maybe it's just a wart. At least it's that and not something. Yeah, get it checked out.
So then, let's say, because actually melanoma runs a lot in my dad's side.
Oh, does it?
They're very fair complected, and they also have tons of freckles just naturally.
Okay.
And so I had a cousin that had like a little patch that she had to get removed on her nose because, in Mexico, we're not raised to put SPF on.
Yes.
I mean, if you went out in the fields, then you would wear a long sleeve and a hat.
The cover up.
Yeah. If you were just doing housework or with your family, we were never to do that.
And I agree. I don't remember as a kid ever wearing sunblock or SPF at all.
So then after, like, she ended up getting like a whole section of that tissue removed, how often do you have to go back to check the rest of your body? And are they checking all of your body once
they should. So I can't say, because I don't work for the dermatologist, but if any type of cancer that you have, whether it's lung cancer, whether it's uterine cancer, breast cancer, once you have ideally beat the cancer or it's in remission, patients are always in like a surveillance. So every couple of months, they either see the dermatologist or they follow up with us. We check markers, we do exams. For us, it's a little more extensive. We have to do imaging and stuff too. But I don't know. I would say that a lot of patients who have a history of cancer, and let's just say they no longer have cancer, are never fully okay with the idea of not getting checked. Like they want to get checked, because I don't want to go through that again. So
100%. And I would think, like, even if, and correct me if I'm wrong, but if I'm a patient and I just got something removed, I mean, are we advocating for ourselves to say, can you please just check everything else? Because I'm sure that you're probably hypersensitive as somebody who has been diagnosed with that, to look at every square inch of your body after, right? But are we advocating for ourselves once we go to the practice and say, hey, can you just check everything? Or
we should.
Are they normally just checking everything?
I can't say that I inspect everybody's inch of their body, only because there's a level of privacy too. You know what I mean? Like,
you're like stripped.
Yeah, you can't like, let me see, your lower back and all. I mean, there's a lot, people are private. They don't want to be completely naked. And even if, we're in the medical field, or, I think maybe we as medical providers rely too much on if something's wrong, the patients are going to tell us.
Yeah.
And that's something that I've learned over the years. Like if you don't necessarily ask, they're not going to tell you,
No.
you know? And so we need to be asking, I guess, the right questions to our patients, but also as a patient, we also you can't get help unless you talk about it.
Yeah.
You know, so like if you do have a funny mole on your butt, but you're embarrassed for somebody to look at your butt, like no one's ever going to know unless you speak up about it. You know what I mean? So,
and I especially think because right now you were saying that you see a lot of women, you don't see a lot of men.
No, not in aesthetics.
So
no, yeah.
I'd like to think that men are probably a little less aware of their bodies and changes in their body than women are. Like, what are the recommendations that you would recommend for like our male audience? Like, what should you be looking for? And even for females, like what should we be looking for when we, maybe have family members that have gone through this? What are we, what
like
are
in
the
cancer
signs?
in general, would you say? Or, so a lot of the big things that we ask patients, especially like new patients who are diagnosed is, sudden weight loss.
Okay.
Where they're not trying to lose weight. So if you're actively trying to lose weight and you're exercising and you're eating healthy and I want to lose 20 pounds and you lose 20 pounds, that, that's the result of your hard work. But if you change absolutely nothing that you do, you're not exercising more, you're not changing your diet, and all of a sudden in like 2 months, you've lost 20, 30 pounds, that's a big sign that something's wrong. Okay. Night sweats. And that's really hard to say because a lot of women, you get night sweats, myself included, as you were starting to change. So that one's a little harder, but if it's like you're losing weight and you're having night sweats, you should probably go get checked out. Any unusual lumps anywhere, just even in my experience in the ER now here, you'd be amazed how many people have an unusual lump or something growing and they don't get it checked for years. Years. And even where growths are coming through the skin and they still don't get it checked out. So by the time they do get it checked out, like it's a cancer that's already spread, and it's a way harder to treat. So I think, I don't know if it's, his Hispanic culture, or maybe just it was like we weren't taught to, I guess, evaluate our bodies. We were taught more like to cover it up and be more private, protect, or not talk about things, but I think we need to be better at knowing our bodies, knowing when something's different, something's changing color, something's growing here, something's hurting that wasn't hurting before. Instead of just like ignoring it, it's not going to go away, or at least, get it checked out for peace of mind.
Yeah. Okay.
Yeah.
I mean, that's very insightful. And I know that there's all these like really beautiful pages now, with social media being so prevalent in everybody's life, where they're showing images. Well, at least like the pages that I follow, are showing different images of cancer can look like this, cancer can look like that, cancer, so.
Well, even like you said, your family member, like something on her nose.
It was a freckle.
Yeah.
It was a freckle.
And it was probably way deeper than she thought. Yes.
Yeah, it was a freckle and she thought that she had like a little blackhead. So then she started to mess with it and then it wouldn't stop bleeding.
Yeah.
It would bleed and then it would stop. And then 2 weeks later, it would just randomly bleed again and then it would stop until she finally got it checked out. So, I mean, thankfully she was aware enough to say
something's not right. Yeah.
So thank you for those tips because I know that there's a lot of people that are probably like, oh no, I bumped my shoulder 3 months ago and that's why I have that lump there.
Yeah.
But
3 months is a long time to have a lump.
A lump.
A lump somewhere. Yeah.
For sure.
Yeah. The other thing is, abnormal lymph nodes is a big sign too, whether it's you have lymph nodes all over your body. So it's not just like here, I mean, if you have, swollen glands in your armpits, you have them in your groin area. Obviously these, are more noticeable. You have them along your, clavicle. But anytime you feel or see an unusual lump,
or swollenness, like how would that look like if you're doing an exam, as women,
it's almost, it feels like a hard nodule.
Okay.
Breasts are very hard to examine just because they're lumpy anyway, right? You feel lumps, whatever. So that's why women should really, 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 really do, self breast exams, because what your normal is. I think just expect when we go to a doctor that they're going to know what is abnormal, but breasts are lumpy. Yeah. You're going to know what your breast feels like. So if something grows there and you identify it, the sooner you identify it, the sooner it can be treated. Yeah. And with breast cancer, finding any cancer early is, the best bet to get, cured.
Yeah. So then are there like 3 things that you can say that you would always recommend for your patients to live a healthier life, to maybe be preventative?
Yeah. I could probably list like 20, but
what would you say are your top
my top things? Nutrition, exercise. I've always been a big advocate of eating well and exercising your body. I probably don't look it right now, but I was not in sports in high school. I was like the nerd. I took 4 years of everything, because my plan was like, I'm going to college, I'm going to do this. But I've always liked different types of exercises just to be fit and to be active. I used to run long distance, races, and I had some injuries from that. And then I was in CrossFit for a long time, weightlifting to kind of get stronger bones that running kind of messed with. But I think people think that exercise is to make you skinny, to lose weight. And it helps in weight loss, yes, because you're burning more calories. But the benefits of exercise are enormous for your whole body, for your well-being, for your mental
flexibility. Flexibility is a huge thing.
Yes. For the endorphins you get when you work out, it helps with depression. It helps with anxiety. It helps with cardiovascular health. The more chances your heart, reaches that target heart rate, it's making your muscle stronger. It's reducing your blood pressure because now your heart's stronger in muscle. Like it doesn't have to work so hard to pump blood, like I said, nutrition, diet, sleep.
The most underrated benefit.
Right? Yes. Your body does not repair itself unless you get adequate sleep. Also, if you're not sleeping well, it will make you more anxious, throughout the day. And it can also give you bad skin, So
I think it's like the sleeping is like a cycle, right?
Yeah.
So like if you don't sleep well, you're not eating well, you're not productive as much, and it just keeps.
Well, and I have seen over the years a lot of patients who complain of fatigue, and fatigue is such a broad, generalized complaint. Fatigue could be anything. Fatigue could be cancer. Fatigue could be anemia. Fatigue could be your thyroid. But I think I'm always like, how are you sleeping? And I don't know if it's just this country or being an adult in general, like broken sleep is normal to people. Or sleeping, I only sleep about 5-6 hours. Like that's not normal. at all, and I say at least 7 or more hours a night, good sleep. Do I get that all the time? No. Do I try? Yes. I go to bed early and try to wake up early. So
That's all good.
Yeah.
I appreciate all the information that you've shared with us. And are there any also quick little notes that you can add? I know your specialty is in oncology.
Yeah.
What things can we be doing for our skin, for ourselves, that are also going to help either people who are going through treatment or just coming out of treatment?
Besides hydrating, because I'm big on hydration and proper nutrition.
We do.
I think we have to look at taking care of the patient as a whole, very holistically. And I think that maybe is what drew me to nursing versus ideally going to be a doctor, because nursing is very holistic when they take care of patients. At least we try to be. I know the way that healthcare is right now, it's very difficult to do that because we're so pressed for time and understaffed and all of the above. But patients, especially going through cancer, need therapy. They need to talk about what they're going through with not just their family member. And I think when, from personal experience too, because, my grandmother passed away from cancer too, I think we want the patients to be strong mentally. And so a lot of them put on this I'm a strong person, I'm going to survive this, but inside they're struggling, and that's not what they're expressing to their family members. I just had this other patient maybe last week, and he was there with a family member, and she's like, all you need to do is just, eat whatever you can, and not knowing how much he's struggling with nausea and the effects of not wanting to eat, and I said, don't force it. Eat what you can, and I don't know if that was a cultural thing, because in Hispanics too, we're feeders.
Yeah.
So I said, he's not going to want to eat. You have to understand that, So giving patients therapy, I always would love it if my clinic had, these people some treatments take 7 hours, 6-7 hours, and they're sitting there hooked up to their IVs. It would be wonderful if a therapist or counselor, could meet with you in your room while you're sitting there, just to talk to you, what you're going through. I don't know if that's done anywhere. I know the other nurse practitioners that I work with, we've talked about that, because a lot of our patients struggle with anxiety and depression, and the fear of dying, on a daily basis. Or every PET scan, is this going to be better? Is this worse? Just being there for them, and letting people experience their emotions. There's a lot of emotions involved with the diagnosis, and once somebody's diagnosed, the whirlwind of starting treatment, and now I have this port, or even I'm going to lose my hair. As they lose their eyebrows, they can lose their eyelashes. And, for people that can be very traumatizing, that's for women, especially the hair, I don't know what I would look like bald, and it's that can be traumatizing, especially people who are very tied to how they look, or mastectomies, or some people have, radical surgery to their face. And it's allowing people to express their feelings, meditation, positive thinking. Your body your body knows what you're thinking and reacts to it.
And
So,
believes it.
yeah.
Because if that's a narrative that you're continuously feeding it, that's what it's going to believe. So,
Yes. Have you read the book, The Four Agreements?
no, I haven't.
You have not? Oh, it's like, I read that years ago, and it was very, not, I would say like life-changing, because you're like, you're right. And it talks about how be impeccable with your word. And it's always, whether you're speaking it, whether you're thinking it, whether it's about somebody else, whether it's about yourself, to just be positive, like if you tell yourself you're ugly and you're constantly telling yourself, oh, I'm ugly,
Then it becomes your reality.
it becomes your reality.
Yeah.
And so you should read that book. I have like 2 copies of it. And sometimes, not everybody's positive all the time. Everybody goes through their emotions. Sometimes I like whip it out and read it. It's not a long read, so.
I would love to.
Yeah.
I would love to. I'm totally into all of that. And, science says that your brain can't distinguish between what you tell it and what is reality. So be careful with your thoughts, guys.
Yeah.
And I know you've heard it, all over the place. You see the quotes, you see the pages and all of that, but you're hearing it from a medical practitioner.
Yeah.
So it's true. So
yeah. And the physician I work with, he's, he tells his patients that too, because, obviously when they're told they have cancer, some of them cry, and he'll tell them you have to be strong because your mental health is just as strong or important as your physical health, and so
probably even more, I would say.
Yeah.
Yeah. So Yvonne, thank you so much.
Well, thanks for having me.
Yeah, thank you so much. And I know that we could sit here for hours and hours.
I could probably talk forever. I go off on all these tangents. So
yeah. So we would be delighted to have you back so we can dive into other little realms of your specialties.
Yeah,
and
thanks.
Answer any additional questions that clients or our viewers will have, both male and female, because cancer isn't biased. It hits everybody and everybody equally. So just be very aware. And, thank you, Yvonne, for joining us today. It's been incredibly enlightening to hear from your expert advice and insights. For our listeners, remember to prioritize your health and wellness, and don't hesitate to seek professional guidance when needed. Stay tuned for more episodes of Beauty Talk Podcast, where we will continue to bring valuable information from experts in the beauty and health industry. Thanks again.
Thank you.
Yeah.